can you hear us?
Yes. Somebody's got an echo in there.
Yeah, I turned it off. Sorry about that.
Okay. Okay, we're good. So I'm gonna call the meeting to order. It is 9:07 a.m. on the 29th of July. Or no, today's August the 5th. Sorry.
August 5th.
I'm looking at the agenda and reading that. So Maria, would you call the roll and declare quorum?
Sure, yes. Charles Fulton,
Here.
Kurt Clark,
Here.
Jason Owens,
I don't see Jason. Oh, Jason's here.
Mike Houston,
Here.
Brander Rupsamen,
Here.
Jason Jones,
Present.
and Dr. Anna Lee.
Here.
Thank you.
All
Okay,
of you
we'll
there.
declare a quorum, and before we get started, I want to make a statement. After we do the invocation and the pledge, we'll have public comment. That will be the time for the public to make a comment. During the meeting, the public will not be allowed to make a comment. You can post things through the chat, but we will not address those at that time. You can address through public comment. Otherwise, the items that we go over will be posted for public comment on the website where you can comment on that. And we will also have a stakeholders meeting at a later time that you can comment there, but not today. Is that fair, Chairman Opiella?
That's good. If you could recognize me, I'd like to send an invitation to you guys.
Let's do the pledge and the invocation first.
Okay, we'll do that.
Okay. So everyone join me for invocation. Let us pray. Most kind and gracious Heavenly Father, thank you for allowing us to gather here today as a state anatomical committee. And let us just make the best decisions for the families of Texas, as that's what our duties are here, and to be diligent in our duties and make these rules that we need to make. In your name we pray. Amen.
Amen.
Would it pledge allegiance to the United States flag? I pledge allegiance to the flag
To the flag
The United States of America.
and to the
To the
republic
republic for which it stands,
one
one nation,
under God,
under God,
indivisible,
indivisible,
liberty,
with
and
liberty and justice for all.
the Texas flag. Honor the
Honor the
Texas
Texas flag.
I pledge
I
allegiance
pledge
to
allegiance
Texas,
to the Texas,
one state, under
under
God,
God,
one and indivisible.
indivisible.
Okay. Thank you everyone for joining us today. If you have public comment, if you would raise your hand, you will be recognized.
Mr. Chairman,
Yes.
I
Go ahead.
want to, on behalf of the Funeral Service Commission, invite the Anatomical Advisory Committee to have a joint meeting with us on August 14th at 9 a.m. at the Stephen F. Austin Building meeting room on the first floor. We will also have it available via Zoom because I know a number of the advisory committee members are not here in Texas. And so you will be able to join via a Zoom link. Chair, for the reference for everyone else, Chair Fulton and I were trying to arrange a workshop between the commission and the advisory committee, as we announced at our last meeting. Scheduling wise, that Thursday was not going to work for a quorum of our commissioners. And so I'm going to invite the commission and the advisory committee meeting to have a joint meeting so we can hear from all of you and not just the chair and the vice chair on the adoption of the anatomical rules. Y'all are free to adjourn that meeting after we get through the anatomical issues, and then we'll move on to the mortuary law issues after yours. All of your items will be up front at the on the schedule that I'm going to release tomorrow. Yeah, I guess Thursday's tomorrow. Yep. So does that sound good to you, sir?
That works.
Okay. Thank you.
I want to make a comment before I recognize public comments too. Everyone keep Commissioner Carnes in your prayers. He's had death in his family, and actually the visitation is actually the day of the commission meeting. So everybody remember him as along. So we have one person's raised their hand for public comment. Whit, go ahead.
Yes. Hi, good morning, and thank you for giving me time today. My name is Greg White. I'm the general manager of the Westin Galleria in Dallas, Texas. I've been leading hotel teams in the industry around the U.S. for over 35 years. Over the last 18 years, the Westin Galleria, as well as comparable full-service hotels and convention venues across the state of Texas and throughout the U.S. have safely and effectively hosted hundreds, if not thousands, of medical training seminars in our meeting space venues. The need is real. Medical training planners have frequently shared with us that they have neat options for hosting their medical training at hotels and convention centers due to the limited availability in size and/or capacity constraints of traditional purpose-built anatomical facilities that would otherwise host this type of training. When anatomical specimens are used as part of medical training at our facilities, we take preparations and administration of this training very, very seriously. And we've been working with the applicable state agencies to this end for many years. To ensure our hotels and convention venues meet all applicable medical safety and dignity standards, we contract directly with industry experts who are engaged in the planning, preparation, and the implementation of every aspect of the training events. On behalf of the hotel and convention industry and the Texas Hotel Lodging Association, I want to stress that our industry is absolutely committed to following all agency standards, participating in all agency established inspections, and want to be best-in-class partners and implement a medical training that is safe, responsible, and most of all, dignified. We appreciate the opportunity to be here today and provide comments. We would ask for the opportunity to be part of the development and review process for proposed checklists, inspection protocols, and any other related rules that pertain to hotel and convention center venues. Our participation can help avoid unintended consequences if we are given the opportunity to share our knowledge of how hotels and convention center space operate and how these facilities and staffing are typically structured. Thank you for the opportunity to provide our comments. We look forward to working closely with the advisory committee and agency staff on these vital issues. Thank you for your time today.
Thank you. Is there any other public comment? Okay, moving forward, we're going to go report updates on our.
Mr. Chair Fulton, I believe Tom Dawaher has his hand up. It raised just as you were.
Okay, I just saw it. Go ahead, Tom. Tom, you're muted.
Give me 1 second. I'm trying to figure this out to get myself unmuted and my picture on. Just give me 10
We can
seconds.
hear you now.
Okay. I'll just do it because my name is Tom Daher. I am the CEO of Innovet Institute based in Chicago, Illinois. We support cadaver-based surgical education, events, and research, and we also support the Texas Hotel and Lodging Association. First, I wanted to express my gratitude to the committee and the TFSC for their continued tireless efforts and attention to these very important issues. I have worked within a management capacity in the whole body donation and bioskills industry for over 15 years, and in that time have worked with or for multiple NATOs. During my tenure, I have been directly involved with the execution of or overseeing the planning of thousands of safely and effectively hosted medical training seminars in various venues, including mobile facilities and both purpose-built and non-purpose-built facilities across the United States and the world. As previous comment, many medical device companies have recognized the need to host these types of surgical training events at hotels and convention centers due to the limited availability and or capacity of the traditional purpose-built anatomical facilities. When cadaver-based medical training at these facilities occurs, we also take our preparations and administration of these trainings very, very seriously and adhere to, if not exceed, accepted industry standards for safety, security, and dignity of the donors. To ensure these venues meet all applicable medical safety and dignity standards, many, if not all, device companies work with and contract directly with companies like ours who are engaged in the planning, preparation, and implementation of every aspect of the training events. While I am not officially speaking on behalf of the entire NATO or medical device industry interest, I would like to stress that in my experience, our organization and the industry at large are committed to following all agency standards, participating in all agency established inspections, and want to be strong partners in the implementation of medical training that is safe, responsible, and dignified for the donors. We appreciate the opportunity to be here to provide comments. I also ask that for the continued opportunity to be part of the development and review process for proposed checklists, inspection protocols, and other related rules that pertain to not just hotel and convention center venues, but all aspects that govern the use of human cadaver specimen for education and training in Texas. We believe our participation, along with many others, can help to avoid these unintended consequences if we're given the opportunity to share our knowledge of how these activities operate at large, and specifically in hotels and convention centers. So thank you, and we look forward to working closely with the advisory committee and agency staff.
Thank you for your comments, Tom. Do we have anyone else has public comment? I don't see anyone else. So now we'll move on over to discussion of updates from our work groups. We had 2 work groups from last time, and the first one was actually about convention and hotels. We have a report.
Yes, Chair Fulton. Our work group was looking to just do some data and research on what's happened in the last few years here in Texas. I believe I sent this to Chairman Opiola and the work group and Maria. Do you all have that document that just kind of goes over the brief of what's happened in the last couple of years for hotels and other?
Yes, I have that. Sorry. 2 microphones on in the same room. I have that and I can share it. Just give me one moment. So Dr.
You got 2 mics on.
We're in a different conference room today, so this is
There we go. That's better.
okay. Okay, go ahead, Dr. Ali.
Yes, sir. I'm trying to see if I see your documents here. Could you increase the
Is there a way to
size?
make it bigger?
Yeah.
There we go.
So you'll see the source of the data, and this is directly from data that's been received from the Funeral Commission. Mandy Villarreal Salvo was kind enough, our new human anatomical chair, to send me an Excel spreadsheet that kind of showed multiple columns of skills labs that have occurred, excuse me, at non-purpose built facilities such as hotels and convention centers, surgery centers, those kind of entities. The columns went from dates to times, who was the one requesting it, where the venue item was, even kind of a DRI, a direct responsible individual for the entity. And so I scrubbed that, took out personal names and emails and those kind of things, and just kind of left a summary of the records, right? So since November of 2023, right there at the very top, sir, we had 49 entries from then till July of 2026. 80% of those were at hotels or resorts, 4 of them at convention centers, 2 maybe a parking lot at a convention center and a hotel, or maybe outside of a surgery center. I've seen mobile units at my own surgery center in the past. Multiple cities, Dallas, obviously, with Mr. White being from the Westin Galleria, there was multiple labs there that was held at his facility. And so their facility had requested, had the inspections, had everything done. Houston, Austin, those 3 cities right there accounted for more than half of them. Obviously, the medical device manufacturers are the number one requesters of these labs. There are associations too, whether national, statewide, regional. There are top-notch plastic surgeons that will do continuing medical education or continuing education from plastic surgeons down to aesthetics. There are some entries in there that, whether just a lapse in what we had or what was given to us that didn't have an inspector assigned to it. 19 of them had no inspection status. Doesn't mean that they weren't inspected or not approved. It just, the box didn't have anything in there, which I'd love to find out what those were and what happened with those situations. And only a few had a canceled or else. 28 of them have approved on there. Then we said we had 49 entries, so there was about 21 of them that not sure what happened to those. Would love to know. And It did not include, unfortunately, a list of who was supplying the tissue, which to me would have been important to know who was bringing in the tissue. But here's kind of a breakdown for everybody to kind of see. And I'm just setting this up so everybody can understand how this process works in Texas, who, where. I see, in 2023 on entries by year of event, it says one. I think pretty much everybody on this phone call and this meeting today would know that there's more than one that happened in 2023. It's just we weren't recording it at that point. But also we were supposed to be recording it in 2024 and 25, and seeing that there was only 10 and 12 on 25 and 26 lets me to wonder how many occurred without them being recorded or sent in and we didn't record it, or they just didn't send in an inspection request to do the labs. I looked through Instagrams, Facebooks. There's tons of labs that are occurring in all sorts of places, and some of them during this year that weren't asked to have inspections, and they had cadaver labs. So there's a wide variety of this kind of events happening. If you'll go down by city there, sir, on number 5, you'll just see more information as to the spread of where these occur. Chairman Opiola, could you scooch it down a little bit on 5 by any chance? Thank you, sir. You'll see Dallas is the one that's requested the most. Doesn't mean that Dallas has the most. That's who's requested the most over the last few years. So, the question to me is how many of our hotels and venues know that they're supposed to request an inspection, know that having a cadaver lab portion to their continuing medical education or continuing education for anything healthcare related is necessary. I truly appreciate Mr. White being on here today from the West End and wanting to be a part of this, and Tom also wanting to be a part of making sure to follow the rules, making sure to do the right things. It's unfortunate that the people who do the right thing sometimes get shadowed or overshadowed by people that don't do the right thing, and whether it's out of ignorance or out of, I'm just not going to report that I'm doing this lab. I don't know. That's for us to look at and determine and decide where we want to go with this. So I don't know how much more is under there, sir. I know this is a long brief, but we'll just kind of scooch down applicants here. You see the spread of different people that ask for this to be done at the hotels and ballrooms and other organizations. You'll see medical device companies on there. You'll see sometimes the tissue companies noted on there. So you'll see Mary's noted on there one time, but then Prolinium is a different organization that does cadaveric labs. Inspire's a giant medical device company. So different organizations on there. And I think at one point, one of the hotels was listed as the applicant.
Yeah.
So whether we have a process of when this happens, how are you supposed to do this? If you'll scooch down inspection fields, you'll see who's done the inspections. Obviously, Kyle's one of our only inspectors at the time. There's 27 of them. There's 17 not recorded. A couple other people. And I believe during the transition from the state anatomical board, you'll see Dr. Hubbard and Mr. White on there as one of them. And you'll see kind of the breakdown of what happened on those inspections. So this is just a good understanding of what happens. I would, like I said, venture to say that there was probably more than 15 or 17 last year, and that the vast majority of them are either not being reported or not being asked to be inspected, or ignorance of the rules and laws of Texas that you can't just do this anywhere you want without having it inspected and approved and done appropriately. If we keep on scooting down, sir, this is just a list of who's applied, where it was held at, what city, and the date of it. And it goes from 2024 up to 2026. So you can just slowly scroll down there and kind of get an idea of who comes there. And then there was 2 parking lot events with the Medtronics there. Don't know if they have their own mobile lab or what. So, and here's where some of the facility contact was used as a facility personnel. These hotels actually listed themselves as the applicant. And then number 10 just talks about things that we didn't capture or weren't sent to us, or there was a gap. And those are the things that are on there for you to look at. And then we had just some misspellings of names, who was on there really, who was the inspector, those kind of things. And so here's some of the questions that arise for our committee to look at. Should we capture the source of anatomical material? I would imagine that since the Funeral Commission has taken over, no one was allowed to bring tissue into a hotel or ballroom unless requested through the funeral commission, correct?
That should be correct.
Right, so if that was correct, and if,
Dr. Ali,
Dr. Ali.
yep,
so just to share with the.
No, I don't think she can hear.
hold on. You guys got a big echo.
Okay, can you hear?
Yeah, you've got an echo. You may want to
Is that
mute
Mandy?
your speaker.
Oh, let me turn. Okay, can you hear?
Yes.
Okay, great. This is Mandy, director on the anatomical side. So we do have the data, what we realized while we were putting this all together for you on how the tissue was supplied for these different events is it wasn't tied to the form, the intake form and the inspection form. So it's in another data set that would require more time for us. But right now we're going through all of the forms for these events and for the inspection side, everything related to anatomical to look for this quality control. So I'm glad I'm glad you put this section in here of like what we should be asking. But that was one of the things we realized whenever I sent you that data.
Perfect. No, I appreciate that. Thank you very much, Mandy. And like I said, these are just general thoughts and ideas and questions as to what we should be asking ourselves. And so a lot of this will be taken care of by the actual inspection of the facility, the events form that they're supposed to fill out months in advance to send to us, the hotel understanding what they're doing, and then all three sections have, who is the tissue provider, and all that information should be available to us as we go forward with some of the rules that we're setting forward. So this will hopefully help with all these questions. But if you know where the NATO or the Will Body Program is sending the tissue, then you can easily cross-reference to see, did that anatomical facility actually get inspected? Is it on the list? Are the right people there? Is the right reasons? Is it bona fide medical education? The kind of the four pillars we've talked about ad nauseum on all these meetings. And so that will help out as we go forward to know what tissue providers there. And then I'd used this phrase in the past, kind of a donor packet. And someone smartly the other day said, you've never defined what a donor packet is. And maybe that's something for us, whether we define that as a term, or we are loosely acknowledging that the donor packet is the chain of custody, the consent paperwork, the serology, and any other documentation that needs to be available, right? And so available, whether printed out or available on a computer to quickly access if someone walks in and says, show me the information on these donors. So that's something else that I think our venue events or our anatomical facilities should know what a donor package is. So when we say, hey, do you have the donor packet on this person? And was this turned into the funeral commission ahead of time? Everything should corroborate very nicely, right? So anybody could say, yes, all these tissue that have come in through a NATO that's approved, it's sitting at the funeral commission information. Here it is on our computer system if you need to look at it and be able to show all those things. So I think that would be helpful. There's a phrase in here about, mobile units situated in a parking lot. The mobile unit itself, it was built as an anatomical facility and it was inspected and approved. The actual facility or the mobile unit itself is fine, but is it parked in an appropriate place? Does it have security to walk in? I've heard stories of people walking up and because they were in scrubs, they were told to go ahead and go inside and take a look. And so, making sure that the right people are coming in and out, how they're capturing that data, making sure that it's approved people that should be walking into that mobile unit. More questions on here. Should the record capture specimen quantity, activity, and conduct the supervision, disposition? Absolutely. That's part of the whole process here of knowing what's coming in, what's being done, who's the DRI on it, and where the tissue's ending up after it's finished. These are things that I think we need to capture to be able to smartly say for the state of Texas, here's what's happening at our purpose-built facilities. Here's what's happening at our non-purpose-built facilities. Here's the tissue coming in and out. We have good understanding and control of what's going on in this industry. So we don't end up with any bad actors that can put a black eye on what we do on a daily basis to train our physicians, nurses, students in the state of Texas. And at the same time, not inhibit our economic growth that we want with associations coming here and holding their meetings and and different organizations coming through the state of Texas. So those are some of the things to look at that we can have a lively discussion about. Does anybody have questions about just the background and the history of us doing this? Does anybody have any statements or thoughts or ideas? I know, Brandon, you got your hand up.
Yes, sir. Yeah, Dr. I appreciate it. Yeah, I just had a question. Is the expectation that for every event they submit for an inspection? Is that the rule? Is that the current rule?
Yeah, we had talked about this at the last meeting,
Okay.
that since walls are changed, venue spaces are changed, that things are moved back and forth, that they're inspected each time prior to, because one group may come and use half a ballroom or backside, or the other group may use all the ballrooms, all the walls down. How that line of sight works, how that security works, everything changes every time.
Sure.
And I get from a perspective of the hotel industry or convention side, it's the same dang place. Why are you making me inspect it every single time? It's the same air conditioning units. But because there's so much mobility to these rooms and different floors or where you're getting to, and
Sure.
I've been at the beautiful hotel downtown, and they have 6 floors of ballrooms, which is amazing. But each one's a little bit different stuff. So the committee had decided that it was going to be per event, the inspections, because everything changes each time.
Gotcha. Okay. No, that makes sense. I mean, you don't want a wedding one day and then a study the next day, whatever the case might be. But is that explicitly stated? I'm just wondering if there's a lack of understanding of, okay, I've had this inspected, it should be good to go, and that carries on and carries on and carries on for however long, you know what I mean?
Yeah. We've discussed it multiple times, and I know it's been a kind of what I understood as a consensus of the committee that you're inspected every time.
Yeah.
And I believe what the statement you're making is actually a really good one, and that is, what do our hotel colleagues know about the rules and laws? What do our device representatives know about the rules and the laws? And your facility, my facility, this is our business, so I think we're on top of it mostly. We know what the heck's going on, but even being in it every day, there's confusing sections and different rules that come up. So one of the things I had talked to Mandy about the other day is being able to develop a couple page brief, 1 to 3 pages, that we send out to device manufacturers, the hotels, the lobbyists, the groups, the associations, to say, here in general are things you need to start looking at, and an understanding that when you get involved, these are the things that are expected of you. If you have more questions, look at these references, look at these rules, look at these laws, call this person, those kind of things. I think we owe that to them, to give them that kind of information. Jason?
Yes, I was just wanting to reiterate, kind of put a little more detail into what Dr. Ali had already previously stated. And this goes back to some of our previous meetings, is that's part of our data collection, part of our knowledge to the general public, part of our registration and tracking of all of these. That's why, and I'm saying this more to our commission members, is the importance of how we design and set up our website and software, because that will help tremendously with the tracking of all this. And then back to my previous statement of, once we have established all of these, I know that we should be in tune of what is going on, and be wanting to know what the latest and greatest information is. But I stress again that once we get these rules in place, once they are active, we need to be sure and do something in order to send out disseminating information to all those that are participants, users, etc., of anatomical and cadaver training within the state of Texas, and those that we've had previous dealings with outside of that, just to ensure that they know that, hey, you may have been doing this in the past, however, you need to be aware of the new regulations in regards to this, because your next event that you're thinking that you can simply put together may meet a no-go response.
Sure. No, I think it's the right thing to do for sure. Is the expectation that we send out like a physical inspector for everyone, or the sites just submit objective evidence that they're meeting certain inspection criteria for each submission?
So the way the rules are drafted that are up for adoption at our August 14th meeting is, yes, number 1, every event is inspected. Okay. Number 2, every event is a separate anatomical, non-purpose-built anatomical facility. And so I think that's part of the confusion could be the fact that, you know, these rules are not yet in effect.
Sure.
The SAB did not have any rules with regards to these facilities that were coherent, I guess is the best way to say that. And so I think it'll be very clear to people, you know, after August 14th, that every one of these events needs to be inspected prior to being held. I'm a little troubled because I think that it was advertised out to people. I know that there were people that once the commission took over September 1st, during that transition period, I know the end of September of 2024, that there was quite a bit of hay made about this, and we're still not having people conduct these events within the law.
Yeah, I think that's a very fair statement, Chair Opiola, that looking at those numbers, I'm not going to go out on a limb and say I'm 100% sure, but I'm 99% sure there was more than that occurred last year and the year before and this year. You can just simply go on any kind of these social media sites and you'll see hundreds of postings of people with, you know, taking pictures and, you know, I'm at this lab and you see the cadavers behind. Not that the cadavers were in the pictures or there was things you could see or something disgusting, but it's just there was a lab was happening in a conference room or a hotel ballroom because you can see, you know, chandeliers, those kind of things, or some other site. But either way, there was only, what, I think 17 posted last year, and we know that's not correct, that there was a lot more. And so the question is, do they?
And everything we received is in that document. Is that correct, Mandy? Yes. Okay.
So what I'd like to do is cross-reference the tissue that was requested to come in with the number of events that occurred and to see where those tissues were sent to. Because the NATO may have said, or the Will Body Program may have said, we're sending it to Houston to this hotel, and they did their part. But did the other group do their part? Did the device company that held it there at that hotel do their part? And did that hotel do their part? And I think you can easily cross-reference and go backwards and probably find multiple issues. You know, I'll just leave it at that. But the idea behind this presentation is it happening in Texas? Yes. Here are the kind of places that happen. Here are the ones that follow what they're supposed to. There's a reason certain hotels show up more here because they're actually requesting and following the rules and following the pathways that are set before them. And that's what I appreciate about that. But like I said, I know there's plenty that don't, whether it's out of ignorance or whether it's I could care less what they think. That's up for us to decide. But the way to put this or I say control it, is by what we talked about last week. Here's how an event form is filled out, the compliance form, all the information comes into the funeral commission, it's approved 6 months in advance, you know, and then all the things that the hotel venue needs to look at and that the hotel's also responsible for what's going on there. And the device company is putting it on as responsible, or the physician putting it on, or whatever association, that everybody knows that you're on the hook here and you need to follow the rules, you need to follow the laws. Here's an inspection criteria, which I think we should probably discuss again about things that could affect non-purpose built facilities and understand that, you know, some groups do it right and other groups do not. And I'm going to guess that the ton of groups that didn't even apply last year to even say we're having these probably don't follow the rules very well, whether they're keeping the carpets clean or keeping the walls clean or whatever it is, or following any of the rules of security or line of sight or how the cadavers are being transported in and out. My thought process, if you don't want to even tell us you're doing it, you're probably not doing most of it right anyway. So that's usually how it goes, right? But certainly not saying that against everybody, because the people that showed up to this meeting today obviously care and want to do the right thing. Jason?
And to add to that, and to Commissioner Opiola, we're not saying that we did not receive the data. Just like Dr. Ali said, there are those that are acting outside the confines of what is here. And part of our registration of tissue, of incoming tissue and outgoing tissue, more so the incoming, is going to help us to track where these events are actually occurring and taking place. Because you may have a procurement organization that is not AATB accredited that's supplying something to a device company or a training company in the state of Texas that's operating outside the norms of some of the others that could be filtering tissue into the state of Texas to facilities that we're not aware of. and we wouldn't be aware of till there's a mishap and it's plastered all over media and everything else. So our rules that we've been working forward with and everything that we've working towards over the last 3 and 4 months is going to help to solidify the regulation of tissue inbound and outbound and the facility places, because like we were saying with our website again, is that they're going to be registering that tissue. They're going to be registering for a transfer. They're going to be providing what entity that is inbound for. And it's going to be cross-referenced by our personnel in Austin and say, I'm sorry, you cannot bring that tissue into this event center or this facility because it is not approved or inspected for such activity in the state of Texas. So all of this together is going to help us better regulate, better track, and better understand how much is being used in Texas, where it's being used in Texas, and the manner in which it's being utilized.
Correct. So I like that. And Jason, you just mentioned about AATB. We all know that AATB is dropping their certification for NATOs, and something that we can discuss and whether we make a recommendation for the commission to think about is we need to start setting standards ourselves for tissue organizations. And so if there's a reputable organization out of whatever, Colorado, Arizona, whatever, that wants to bring tissue in, we need to make sure they're registered. We need to make sure they know what a donor packet looks like. We need to make sure they know where they can send tissue to, how they're supposed to send tissue to the state of Texas, and supply a pathway for non-AATB accredited tissue organizations, because there's plenty out there that are just as solid as an AATB one. There's only, I think, 6 or 7 AATB NATOs out there, and now that designation is actually being taken down, though they'll hold their AATB accreditation until it runs out, what happens then to them? So one thing we need to consider is if a tissue organization wants to send here, and I think this is part of where we could be getting some of this, I don't want to tell the funeral commission about us because they won't let me register because I'm not an approved AATB NATO, and then they just kind of send it in the back channels, versus Texas does have a pathway of, if you're not AATB accredited because that is no longer available, here's how you do it. Send in all your paperwork, you get registered with us, all the laws, you check off on everything. Anytime you're sending tissue, you register, you follow everything else a World Body Program or a NATO does already here in the state of Texas. And that way we kind of push them into a pathway of, this is the right way of doing it, and we'll work with you, but here's how it's going to happen. Something for us to consider. I know it's not, a conditional NATO is in our state Senate bill, but we need to start thinking proactively of what it looks like to have a kind of a Texas NATO or a Texas approved NATO as we move down the line.
Under that conditional title.
Correct.
Agreed.
So we don't have
authority right now outside of the AATB accreditation process and statute. So that's why we crafted the rule the way we did, was you're conditional until you can get accreditation. When that system evaporates next session, hopefully we'll get that fixed in statute. So that's the constraint that we have right now. Is the statute was crafted in the presumption that you would have AATB accreditation, and now that no longer exists, that's why the rule is crafted the way it is.
Dr. Ali,
yes,
and committee, I just also want to share with you guys that one of the other gaps that we've just discovered in our tracking for these transfers is that right now the transfer requests are only being done by the the receiving entity. So they're the ones that fill out the request form for a transfer. So we don't have, currently right now, we're not tracking if a NATO or if a World Body Program, whoever is the holder, the keeper of the specimen, is sending a specimen to like a one-time event. So you had talked earlier about cross-referencing the data. We wouldn't be able to do that right now because we haven't been capturing that. We only have been receiving consent forms from the Willed Body Programs or the NATOs related to the specimens, but not whenever things are being transferred.
And you're,
Right.
sorry, Dr. Riley. So let me understand the capturing of the data. Is that just not being placed into a spreadsheet? Because on the request of transfer form, it has the supplier and the recipient on that said form. So when you say capturing data, have y'all just not been capturing those specific items off of that transfer request form?
So on that transfer request form, the only person that, or the entity that fills that out is the receiving entity, not the sending entity. So if we can look at what's put on the transfer document of if they fill it out, which there hasn't been 100% compliance on all of this. And again, we've only had one staff member for 6 months helping with this stuff. But we don't have anything like a check on the other end of the pipeline letting us know.
Are you talking outside the Willed Body Programs of the state of Texas and the NATO side of this? Because that's where I'm confused, because on the Willed Body Program side, you have not only the requesting entity, the providing entity, you have to receive the consent forms from the Willed Body Program back to y'all's facility before y'all will initiate and grant transfer to the receiving entity. So are you saying you don't have that data for the NATOs? Because I know you have it for the Willed Body Programs.
Right. So yes, for the NATOs, I apologize. Right now we have like, if they're bringing a specimen from out of state for these one-time events, we have no way of knowing that that's who the provider is, especially if in the transfer form, it's not being shared with us. Yeah.
And that's part of what we have been discussing in reference to all of our
Right.
registration and transfers, is that needs to be inclusive for anyone who is transferring specimen either interstate or continental. You need to have that particular information need to be who's your supplier, where is it inbound to, and where is it going, and what's it going to be used for. So that's part of, like we were saying, your website and your data keeping is going to be your savior on being able to track all this and approve all this.
And I think,
so the more information we collect, the better we are going to be as far as operation.
and Jason, I think
part of
that's
the
gonna
issue too. Can y'all hear me?
Yeah.
Yeah, is we had a moratorium on import and export until May 4th of this year, right? So there shouldn't have been any tissue coming in from outside of this state for these events before May 4th of this year. And then after we lifted that moratorium as a commission, now we have the proposed rule that we will adopt August 14th that will require notification of us for import, because that's what the statute allows us. We don't have discretion over imports. We have discretion over exports, but that notification will include that information under the rule that is up for our commission adoption on August 14th. But we should not have had any tissue coming into this state from out of state prior to August 4th. So it sounds like there's just a kind of like what was talking about a black, I don't want to say black market, but that people are not notifying us and
Correct.
continuing to have these events.
Right. And that's what Dr. Ali, both I and Dr. Ali and some of the others are alluding to, is that has and does take place. That's why once we get these rules in place, once we have the processes in place, getting that disseminating information out to any and all entities that could potentially need and want, need to know this. And just like we were discussing in our last meeting, there will be penalties involved with such activities. Because I've had that question. I'm not going to throw anybody out. I corrected them for it. I'm not going to put anybody out there, but I have had individuals that conduct medical and bioskills training that ask the question, so can we not utilize tissue from a non-AATB accredited entity? And if they aren't AATB accredited, do we have to register that specimen with the state of Texas when we're bringing it in? Because we have used these non-AATB accredited entities to have these events. in order to have specimens. So yes, there is a black hole or a black market, for lack of a better term, but there are those that are not working within the confines of the regulations.
Well, I think
We're going to do our best to stop that.
Yeah, that's.
I think
We just hired an anatomical inspector last month. It's going to be dedicated to this, and we ask y'all's help in identifying, what's these illicit events that are going on.
And
Just
Kurt has
while-
his hand up.
Since you had said the statement, I apologize, Kurt, for stepping over. I would also encourage the possibility of not our inspector, but one of our investigators periodically making a trip to some of these events that are occurring at the non-traditionals and even traditionals and walk in for a site inspection.
So the challenge is us knowing about it. If people are not reporting it to us, it's easy to inspect the ones that have filed with us, right, for an inspection. The harder one is trying to, follow Instagram, Facebook, web pages, those sorts of things to cross-reference people who are operating outside the system. Is there a registry of how do people find out about these events? I would imagine there's medical societies, doctors, organizations, those sorts of things.
they get posted on association websites, some of those continuing education websites. If you go to aesthetics, they do a lot of labs and live model injections. And so different organizations are kind of the leaders in that field, or different pharmaceuticals are involved with it. And they post, hey, we have this conference happening this week and this month at this facility. So there's definitely ways of knowing what's kind of going through. You're not going to catch it all, but there's certainly ways to kind of understand what's happening and to see if it corroborates with who's registering to do the cadaver lab. I don't think that's extremely difficult. It just takes someone sitting down for a few hours and shifting through some internet postings and conference postings. You can kind of find them as you do some Google searches, because they want people to know about them. They want people to come to them. That's how they get their participants.
And I'm a lawyer, not a doctor. So, if you want to do a continuing legal education in Texas, you have to register with the state bar so you can get credit for it. Is there a similar situation for doctors where they, in order to get continuing education credit in the state of Texas, that they would have to register with the medical board for these events?
So we don't register through our medical board. We go to the continuing medical education that's proposed, which is usually some kind of university affiliation to be able to provide the CME. And then we take that documentation and file it with our board saying, here's my 40 hours I did for the year. But we don't have to ask our board. But a lot of these meetings, you're not going for the CME credit. You're going for the experience of, I don't know how to do that procedure. I'd like to learn that procedure. I don't care if they're going to.
And I mean, obviously, this is important medical education that we want to continue to have to educate our physicians in this state. I don't want to, by any means, restrict that from happening. But at the same time, in terms of protecting the public, if we have events that are going on that people are not reporting to us, that bothers me.
Hey, what I have on what this looks like, the same thing as I agree with Dr. Ali and Jason on a lot of this. There's two different roles for these people on, them. There's a lot of horror stories I've been in this 30 years in the largest medical center in the world, and a lot of the hotels here, there's been a lot of horror stories about back and forth, which, trying to clean it up, as you can see, because there is. But a lot of them, Commissioner Opiello, that we do, a lot of these are not continue ed. They're just, like Dr. Ali says, it's just training for these. New things come out. Doctors have never done it, and you can't do it. You can't practice on the living, even though it's called a practice. So the next best thing they do here, they can do it multiple times on a lot of this stuff without any issues with it, and they get a lot better at it. And we have plenty of studies on some of our labs here on intubation and everything that shows pre and post cadaver lab of the success rate and stuff like that. So, but most of it, like I said, is just learning and not continue ed.
Mike Houston, you have your hand up.
Mike has his hand up. Just want to let y'all.
I just think that a lot of the underreporting that Dr. Ali showed us earlier is not people being unscrupulous and the black market and stuff like that. I just think a lot of it has to do with the fact that there wasn't rules posted for so long. I mean, I don't think that everybody was in the know.
I agree with that. I think once we get everybody informed, they need to do it. It's gonna be better.
Well, and Mike's right about this because I have emails from I don't know how many lawyers back on the funeral commission that was helping with the anatomical side. One says, no, it's just the exports. And the other one says, no, it's everything. And then 2 weeks later, the lawyer says, no, it's just the exports, not the imports into the state of Texas. So there was a ton of confusion over the last 18 months with each lawyer looking at it differently or each executive director calling it differently. Chairman Opili, I think there was an incredible amount of ambiguity as to what was okay and what wasn't. So I don't think it was a let's do this underhanded or being deceitful about it. I think most people were like, I have no idea what you guys want. I'm just going to continue business as I've always been doing it. I do follow the rules. I do it appropriately. I do all the things that I'm supposed to, but I didn't know if I was supposed to report this or not. So before we go down the black hole.
I recognize that. I recognize that, Dr. Ali, and I on behalf of the commission, I own that. That's not going to be the case going forward under my chairmanship.
And I appreciate that. And I think what all of our constituents and stakeholders want is a very clear path of what do you expect of me to do, so I follow the rules and do it. And I think that's why a lot of the stakeholders on here today is just please make it very clear to me what I'm supposed to do, how the inspection is supposed to happen. That's why the checklist, like here's the stuff you need to be ready for. Here's an events compliance form. Here's what you're on the hook for. Here's what you need to do. And I think that will help us out greatly as a committee and as a commission of we have a very good understanding and control of what's happening in the state of Texas, who's doing what, and it's doing it, and we're doing it appropriately. And like you said, we don't ever want to slow down medical education, medical innovation, healthcare, safety, all those kind of things. We just want it done appropriately and correctly and under the rules of Texas and the laws of Texas.
Okay. Anything else on this one?
No, sir. That was just like a presentation. I think this really corroborates with the stuff we talked about last week with what does the inspection look like at these places, what rules and regulations they need to think about. There's a lot of things out there that can affect you from some OSHA stuff, TCEQ stuff, how you're holding the tissue, a lot of things that whether we address or if we want to go through all those or if we want to keep on thinking about that. But, the purpose-built facilities kind of have that. Like, I have signs as you go from areas that are not part of the lab to areas that are part of the lab on the door saying you're entering a BSL2 area. There's radiation behind this door. There's biohazards behind this door. There's sharps and all those kind of things. And it's posted very clearly. And I appreciate one of the large medical device companies, they sent us an inspection list just 2 days ago saying for your lab to qualify for our large OEM, this is one of the top 3 in the entire world, to come and do a lab at your facility. Here are the things we expect. And it's more than the things we had in our SAC committee inspection of purpose-built or non-purpose-built. So they want to see certain things up. They want to see eye washes every 10 feet. They want all this stuff. Their bar is set quite high. And so I want to make sure that if we're setting our bar the same height as a large medical device company's inspections that they do of us, should we do the same thing for ourselves and all our anatomical facilities? And, and like I said, I've watched plenty of people with PPE walk out and try to walk to the outside bathrooms in the lobby, and we have to stop them and say, you got to take that stuff off. There's bathrooms over here for you on purpose, and we can't have you traipsing around the place with all that junk on. But those are things for the committee and the commission to think about is, do we want to set that bar high to make sure we take care of everybody?
I think that's your next step. I think we have the rule that is going into effect hopefully on August 14th. That makes clear to everybody, that the non-purpose-built facilities have to be inspected. But now we're that's what we need your help as advisory committee to develop those standards. And the question is do the standards need to be any different as a fundamental, question from the purpose-built facilities? Obviously, hotel room is a temporary facility, but, should we have radiation protection for the other people who are in the hotel and in the dining room right next door when you have a C-arm that's operating the room. I think that's probably a good idea to protect the public. All these other things that you talked about, I think you need to bring that to us as a recommendation of what works and what doesn't, and work with the gentleman from the Westin Hotel that was, and other hotels, that put these on to develop that. That's what we need from you guys.
100%. I think we can clearly at the next meeting put up some. So look, there's federal standards and there's state standards, there's laws, and then there's best practices, right? And so I don't want to get the ones confused with the law, and because someone's going to say, well, the law doesn't say I need to do that. I understand, but best practices of how your sharps are maintained, or where you're throwing your biological waste, or this and that. There's BSL biosafety lab levels, and there's best practices in those and what you should do, and the PPE provided and those kind of things. And so, I want everybody to understand that these are best practices, some of them, and some of them are required by law. And there's always a little gray zone in the middle where someone says, the law doesn't say I need to do that, but there's best practices. And then there's also the whole dignity and respect of the donors and what that means. There's not a law that says this is the definition how you treat a donor in a dignified manner. It's more of a kind of a moral kind of standard. And so you're right, the hotels and convention centers and their events coordinators and the people that are responsible should be involved in this and should understand very clearly what level we're setting, so they follow that high bar, because that's what we want. We want the bar to be set up high enough where not every person can be involved in this who doesn't want to put the time, effort, money involved in this to do it right.
I think ultimately this would protect the hotels too. I, as a consumer, might not want to stay at a hotel that something that was substandard was done at, that sort of thing. And so I think that I want to encourage you guys over this next couple of weeks to work with them to figure out something that works, if it can work.
Something that this is Mandy again. Yesterday during some staff discussion, yesterday during staff discussion of this situation that came up, that was an interesting corollary, is that so my dad's a physician, my mom's a pharmacist, and so I grew up in this medical world. But there's one thing, a lot of our physicians are trained that you're going to be working on living humans. That is your practice and your profession. And then in biomedical device companies are creating devices to go into living human beings. And this is the beautiful part, I think, with Anatomical being brought over to Funeral Service Commission, is with you specifically on our advisory committee, we have these experts in the industry that have that compassion of respect and dignity to our decedents, that will their bodies for research. And there's sometimes when in industry, whenever you're working for that dollar to create really cool devices that are going to propel industry forward, there can sometimes be a moment of forgetting about we're working on decedents. And so I appreciated the conversation I had with Dr. Ali the other day, discussing how we can bridge this gap on the research side, doing these cadaver labs, having them at these non-purpose built facilities to allow for our hotel industry and conference industry to still be part of that, but also understanding that, these are human beings and our job is to give them dignity. And we want to just ensure that standard is met across the board, and that what the standard is the standard. We're also compassionate to the fact that Texas is the first state doing this. We know that this is not the norm for our NATOs and hotels that are international and national wide. This is new. And so that's why we're not rushing this process. We want to make sure that we're getting public comment, we're taking everything under advisement, and we're getting all the different perspectives so that when our advisory committee makes the recommendation to staff and then staff sends it to the commissioners, we're as absolutely well versed in this as possible. So I just wanted to put that out there for everybody to know that all of this is being looked at from as many angles as possible, all the different industries that are touching it.
I think Brandon has his hands up.
Yeah, Brandon has his hand up.
I agree with your comments there. I think, and Dr. Ali or to the commission, if we're going to put together a work group, I'd like to volunteer to be on it for this one. Just, I have responsibility in my role for not only worker safety, but also regulatory compliance, right? So compliance with all of these other entities, whether it's DSHS for radiation, TCEQ for environmental, TFSC, whatever the case might be. And so I've been doing this probably for close to 15 years in terms of the compliance aspect. I think it's the right thing to do. Setting the standard, I think it's important to strike balance, right? So in terms of compliance, making sure that there's a balance between what the standard is and the ease of compliance with that standard. And whether that ease isn't necessarily the rigidity or the rigor of the standard, but how we enforce compliance, whether it's there's a internet portal where they can submit objective evidence, or we have inspections, or we have, to Jason's comments, a certain percentage of sites that we randomly show up to every year, or whatever the case might be. I think there's definitely a path forward to make this both benefit stakeholders and interested parties, and also ensure that we're protecting the public and the TFSC as well.
The work group last time, and Brandon, I don't think you were at that point in the meeting last week. It's Aaron Ali, Jason Owens, and Jason Jones. We can't have 4 on it.
Gotcha.
But he can still.
But that would be a 4. Here's the thing: under the Open Meetings Act, we really have to have less than a majority on that work group. So, Chair Fulton, what do you want to do on that?
So, does anybody want to step off the committee and let Brandon on it, or y'all want to leave it the way it is?
Yeah. If it's already set and you guys are going to work on it, that's fine. As you know, we're going to have conversations about it. I don't necessarily want to be part of it, but I do. Yeah. This is one that I think
I myself value the insight in which he's bringing over a wider range of oversights. So I would be willing to step down from this work group to allow for Brandon to enter into it, to give his professional.
You good with that, Dr. Ali?
Absolutely. That'd be great.
Okay. So, Rhea, would you remove Jason from that, put Brandon on it?
We just did.
Done.
Okay.
Thank you, guys.
Chairman Opil, I want to make sure if Brandon and myself and Jason Owen, I think is the third on the right,
Yes.
if we submit our paperwork or our thoughts to you guys, are you allowed to disseminate that to everybody in the group so they can read it ahead of time?
We are. What we just can't have is discussion offline that's not in the eyes of the public.
Correct. But can those people that get it that aren't part of the work group give information back to Maria or Mandy?
Maria can send informational
Yes.
material to everybody on the committee.
So what we'll do going forward, just to create a nice little timeline, is the work group will send what their work product to us here, Maria, myself, and Eric, and then staff will have a chance to look at it, and then we'll disseminate it to the full committee.
That way, Jason, I know you stepped up, but at least you'll see what's going on, and I guess you could give your input back to Maria's team, and they can kind of put that all together and kind of pass that information on to everybody, so it's not a quorum.
And just time frame wise for rules, just to give you guys an idea of, I don't want to lock us into a date, but assuming everything goes well on August 14th, the next opportunity for the commission to meet to adopt any rules that y'all would propose would be at the earliest mid-October. So that's what we're looking at right now for our next commission meeting would be mid to late October.
And I would put this out there that when we're submitting stuff, send it to Mandy, since she is our anatomical person, because Maria's got a lot on her plate with the funeral side too.
That's a good point.
So send it to Mandy, let her handle it, and if she needs to go to Maria, she will.
Yep.
Okay.
Thank
I
you,
usually
Charles.
I usually CC it to Chair Opiola and Maria, but Mandy, I'll be sending it directly to you now as the chair of the director of the anatomical.
Thank you.
Thank you.
Chair Fulton, if you're okay with this, I know we have OPOs that we need to discuss, and it's 10 to
Yes.
15, and so I have nothing else. I don't know if the other two members have anything else to add to this.
Okay, let's move on to the next thing. So we had one for, I believe Dr. Ali submitted a proposed rule for transportation, correct?
Yeah, we discussed that at our last meeting, did we not? Or
Yeah, and so that looked good enough to go on through, right?
it has not been. The governor's office was going to get back to me tomorrow on it. So if we can, we'll have it on our August meeting. If not, it'll bump to the October meeting.
Okay. And
But I have sent it up to what's called the Regulatory Efficiency Office. There's a whole process that has to be done for that. So, and they should get it back to me tomorrow is what I was told yesterday.
okay. And did we have another work group, right?
Yes. The OPOs.
Yep. You want to report on that?
Yes, sir. So I believe that brief was sent to the team and to Maria, Mandy, and Chair Opiola. Do you all have that you could bring up to share?
I do.
Thanks, sir.
Give me one
So
second.
I've been looking at it and bringing it up. Same thing once again. The question.
Do you want the PDF or do you want the Word file that you sent me?
Let's do the Word file in case we need to change anything, or if we need to make any edits, if that's okay. But the request to the work group was explain to us what OPOs are, what they do, what their regulatory purview is, and who does this and what is it? Because I had heard interesting comments of, they don't use most of the body and then they sell it off this and that. And I can't stand hearsay. So let's find the real data and see what it's all about. And so, the question is, how much purview does the funeral commission have certain over this and how much does it not? And where do the gray zones occur? So we know our definitions of will body program, NATOs, and anatomical facilities, but there's the definition of what an organ procurement organization is. So
it's none of those three, definitely.
None of those three. And then here's kind of what it is as you start to understand what it kind of goes through as you go down to our section 3. I just kind of listed some activities and what statutory things occur, and does the commission have jurisdiction? Now, listen, I don't make the rules here, the laws. I just took what information I could and processed it, and then these are the things that popped up on the flags for us to look at. So things for us to consider and look at, and I'm not saying none, they don't have jurisdiction. I'm just saying that's what popped up as in general. Could it be more than none? Absolutely. But these are the things we need to think about. OPOs work on people who have consented to give living tissue. So, a transplantable tissue, right? So whether it's kidneys, liver, lungs, cornea, it doesn't matter. A lot of times it gets to them, maybe it was from a car accident, and there's certain things that person wanted to give, but the kidneys are destroyed or the liver is destroyed and they take what they can. And then from there, the process is kind of a simple algorithm. If they also said, hey, if you can't use, or if there's things left over, I'd like to donate that body to science, then a willed body program or a NATO can receive that. And it falls under the Funeral Commission's purview of this is a donated specimen to science. And so every rule that we've always set up would follow through. But if they don't donate it to science, so now the body that was left over and things that were hoped to be used can't be used, what happens then? Then the final disposition goes back to the family for cremation or burial or the other things that happen in a final disposition that are not donation to science. But they can also consent that there are tissue that if you can't use for transplant at that moment, like a kidney, keeping that alive and giving it to another person on the kidney transplant list, that I want you to use that because it will become transplantable down the line, meaning there's tissue that can be processed as demineralized bone matrix that's used as a putty when implanting devices, patellar tendons, hamstring tendons that are used for ACL repairs, Achilles tendon repairs. There's all sorts of tissue that can be transplanted later after the antigens are removed off the tissue, after processing is done. And that only way to get to that is by either sending to research institutions that work on it to create new innovations, or B, we already know that a hamstring tendon from a cadaver can be used in a patellar, or a patellar tendon can be used in an ACL repair. And that process is already approved by the FDA and all the federal groups. And then that tissue is then earmarked as to transplant into humans later in a surgery. But that could be 6 weeks later, 6 months later, right? So these research companies or for-profit organizations, that's part of their business, is they find that tissue from those OPOs. They take the tissue, they prepare it, and then they supply it to hospitals, medical device companies, all sorts of healthcare entities to be able to use for that. So that's what this is kind of going through. And so the question is, where does the Funeral Commission step in and where does it not? And so for us to have a lively discussion about that, there's stuff about how they're accredited and who looks at them. This goes to the federal level of CMS, NIH, all those kind of things. And it talks about, Centers for Medicare and Medicaid Services. There's all sorts of things, the National Organ Transplant Act, that cover them. So they're highly regulated. But I think the question came up is there, I hate to use this phrase, this black market of they're selling tissue. You can actually go down there and the actual federal government and the procurement organizations have set standards of what they sell a heart for, a lung for. And it's not like they're trying to sell it to make money. It's the cost of doing that business and to be able to do all this transplanting. And so it's all in this brief. I'll stop here for a second and see if the committee has questions about it and what we were discussing, or the commission has questions about it.
Or is it, does the committee have any? I'm sorry, I want
I
Well-
agree with Dr. Ali. I don't think we should on that soft tissue on that stuff, because the soft tissue that we excise from our own program, is cremated and it is not tracked or anything like that. So I mean, it's one of those. I'm on the option of that, like, it's not like a bone or anything where you can, because the soft tissue, once it's cremated, there's very little residual. If there's any residual on any of this stuff, I don't even think they cremate any of that stuff that they do harvest on that when they do. I don't know.
Is it you?
I guess the question is to Chairman Opiella, because it kind of was your tasking of differentiation between what is the commission oversighting, what is the commission not oversighting, how is that defining line. We had explained it as the final disposition of the body is not donation, that the harvested tissue has been agreed upon by the donee to go to the OPO, and that they are the ones that are under control of that particular tissue for transplant or research to further other medical uses for that transplantable tissue. And so for me, it's pretty clear that if donation is the means of disposition of the body, yes, it falls under the purview of the commission. If it's simply an organ, tissue, bone, eye harvesting to an OPO, that does not fall under our purview for tracking of said tissue. And they have very extensive tracking of their own tissue that is harvested, and they're inspected through FDA, because this is something that's going to potentially go into a living human recipient. They have a lot of oversight in reference to their usage of that transplantable tissue. So there's not any I'm not going to say that there could never be a misuse of said tissue or a mishandling of it, but the case of that would be very rare. I have not heard of one in my time of being around healthcare or anatomical education, but this more or less is kind of what is your opinion on it? Because that's what we were working for, was your opinion of is
Chair
this clear?
O'Keefe, there's another document I sent you that's called organ procurement. It's more of a explanation of what these OPOs do. I think you threw up more of the rule, but there's another document I sent called organ procurement. If
We
you
do
could,
want to clarify that it's not so much the concern of what's happening with the specific organ that's being procured into a transplant to a living person. It's what's happening to the decedent post the organ being harvested. That's where the OPOs, when we spoke with them a few weeks ago, and in our research, there seems to be a gap of what we care about, which is following the through to final disposition of the decedent post organ harvesting. There's verbal claims that the decedent's body is being handed off to funeral homes, or the rest of the decedent's body is going to a willed body program, but there's no tracking that's being shared with the Funeral Service Commission, so that we can ensure through to final disposition the integrity and respectful life cycle of that donation process. Like, we figure there's two pathways. You're either going to, after your organs are harvested, you're going down to a funeral home for final disposition, or there's the option that there's more happening on the donation side. And we just want to be able to understand and have for any Texans, family members that want to ensure their family member was treated with dignity.
That
right,
comes, sorry, Doctor. That comes also back to the website and the registration of the donors coming into the will body programs and the donation programs. Once that is up, where the now TFSC, where it was the responsibility of the SAB to register all those that are donated, once the TFSC has that to where each will body program and procurement organization can register that donor, that information you will have again of what happened to that decedent if they were donated post their harvest. Now, obviously, if you're also wanting to know who went to a funeral home, then you're going to need to, then the TFSC on the funeral home side of death care is going to need to also combine and come up with a rule within their statutes that states that a record of disposition for anyone who donates organs or tissue for the purpose of transplant has to report what the final disposition was of said individual. But that's going to create a whole nother line of data collection for y'all on that end. But like I said, if y'all were receiving your registrations from your will body programs, and even now the registration from the DATOs within the state, you're going to know that the final disposition of that individual, if they were donated or not, because they have to be registered with you.
Brandon, you ever end up?
Yeah. No, I just had a question, and thanks for that, Jason. Like, understanding what the logistics of that would actually look like for this registration, would they submit the consent that explicitly states the final disposition that they've agreed to, and then that would have to handshake with the funeral home side, where they don't only have a record of it, or they're required to maintain a record of it, but they have to submit that record to the state? Or
right, I don't think that the commission wants to go down that particular road in reference to dispositions there, because you're gonna, if the body's going to be cremated, there's going to be a record of cremation of that individual through the funeral home, because they have to go through the same standards whether the individual donated anything or not.
correct.
So there's records on both sides of the fence. What the commission currently lacks is a collection of their registered donors that are coming into the will body program. So, like, the information that the commission asked all the will bodies programs for back earlier this year of the number of donors in which they have intaken since basically 2024. That data is information that they should have already been collecting, but because of the learning curve of operations, that information wasn't being followed through to them because they didn't give a line of means of reporting that. So the registration of those donors will solve this completely of what happened to that donor after their heart was harvested. Well, it either went to a funeral home for a funeral and their death certificate's going to say burial, or it's going to go to a funeral home for cremation because the family elected for that, or it's going to say final disposition of that individual is donation, and you're going to have a record of registration.
Yeah, because I mean, so when the OPO is done, they've got to give it to a funeral home or to a well body program or something, because they don't have authorization to have it cremated. Crematory is not going to take the body from them. They don't have authorization to go to the cemetery because the cemetery is not going to allow them to come in. You have to be a licensed funeral director and embalmer to bury that body.
Right.
So we're chasing down a rabbit hole here that's really not
Correct.
needed.
Yeah,
I just want to make very clear that I think the pathway is very clear and regulated and followed. If the question from the funeral commission is what happens to the bodies that do get donated to science, well, that's a very easy answer, and that is when that body comes to a will body program or a NATO that's accepting that, then it is registered with the state and the funeral commission, and then that body from that point forward is under the funeral commission's purview. Otherwise, its final disposition is going to be, like you said, funeral home, crematory, burial. I think the gray zone question is, are their bodies not following that and just being sent off to these research facilities? There is skin that's removed. There's long bones that are removed. There's tissue, and this is organ harvesting because the skin is an organ and the bones are organs. It doesn't have to be a soft organ. And those things are sent to research facilities or private companies that process, make it to be able to transplant it later back into the human body. So that is a transplantable thing. So that is not part of the funeral commission. So the reason I put this big brief together is to show you what a NATO is, excuse me, an OPO. So if you scooch down a little bit, it actually starts to tell you all they actually are set by CMS to guarantee this is what they get paid for these harvesting. And then you look at these numbers, you think, oh my gosh, they're selling body parts. Absolutely not. This is not a cheap process to harvest an organ and the skill sets involved in it. But this is published. This is CMS regulated. This is Medicare regulated. Yes, sir, just keep on gently going down. And things that can't be transplanted, like I said, the disposition is either it's going to go to a funeral home to be cremated or buried, or it's going to be, if consented, donated to science, and it'll go donate to science. That's when the funeral commission steps in. But it's this gray zone of the long bones and tendons. Once again, all of that is used, and I put really detailed things in here for our funeral commission staff to read. And if they want to hand this off to the commissioner so they understand what's transplanted, but it might be 6 months later. And so to understand that, and then also the kind of valuable consideration of the money and the tags of how much is a kidney, how much is a lung, and all that is in here and why it's in there. It even talks about how much money is generated from this. It's a large industry, but don't let it confuse you with salacious statements of, well, these are people selling bodies and organs. That's baloney. These are people providing a kidney or liver for your loved one who's going to die if you don't get one. And then it talks about the Texas OPOs. So it's got them all listed there. I think there's 5 of them, and it talks about them right there.
Now it's down to 3. I think that the 2.
And Dr. Ali, did I see a line on them that stated that these had to be registered as nonprofit or no?
Yes, at the very beginning, they're all nonprofits. Correct.
Yeah. You know, it's a big deal. Like when Southwest Transplant Alliance does this at the funeral home, there's a plaque up at the registration desk and everything. I mean, it's a huge thing. I mean, the bodies are going to funeral homes or to well body programs. So they don't have a way to get rid of the body any other way.
And so the concept behind our work group doing this is making sure the commission understands exactly how an OPO operates, what kind of regulatory bodies are over them, which are big heavy hitters from the federal level, and how they play in our state, what the group names are, what they do with the tissues, and the salacious statement of, well, what are they doing with the bodies if they're not being donated to science or they're not going to a funeral home? There is no in between. And
That's right.
Charlie said it very clearly. an OPO can't just show up at a cemetery or show up at a funeral home saying, I, as one of the OPOs is giving you this. That's not the way it works. It always goes
Not gonna
back.
happen.
Right. So the fear of, are they selling body parts? Let's make sure that you can always twist something to make it look bad. Because if you look back up there, you're like, yeah, they're selling hearts and lungs. Well, that's baloney. It's a cost recovery. They're regulated very heavily as to what they can and can't, and it's a set price. So they can't go out and say, well, who wants the lung? I'm going to upgrade this bid. And you got to keep on bidding like it's eBay or something. That's not the way this is working. But that's in here to show you guys exactly what the pathways are for an OPO and how they function. And what they do is incredible, and the amount of lives they save. The research part in the middle is where some people get confused of. So they're taking the long bones and they're sending it off to some company that makes money off this. Once again, it's going to become a transplantable material down the line, and that's 100% in their purview to do. And they're followed by CMS and Medicare and all that, because those parts, tissues, whether going to a research organization to develop the newest innovation or going to a company that knows what to do with those tendons to send them back, and they end up in the operating room 6 months later to be transplanted. All that is appropriate. All that is following the laws federally, and is heavily regulated.
So I really appreciate you putting this together, because that's exactly what we were looking for, is the facts on this. I think under the current statute, the commission clearly doesn't have any jurisdiction over human transplant, organs for transplant. And I think the only gray area, like you say, are non-transplantable organs to research. And if you look at the statute right now, the line in 692A that says tissue banks in coordination with the commission. That's very vague about what is coordination with the commission there. And so I'm almost thinking that this is something for the legislature to look at, and not necessarily something for the commission to look at. The key here is the function of what's being done, not necessarily who the organization is, but what function or is being handled here. Is this? I guess the only question I have is this an alternate pathway for tissue outside of will body programs and NATOs for education and research? And that's my question to you from reading this. Is this an alternate pathway? For instance, if you were to, like we were talking about earlier, if you were to have an educational event at a hotel, could the tissue for that event come from one of these organizations without first going through a NATO or a will body program?
So my answer, but I don't run these organizations, and I think the next meeting we should get a couple of CEOs of these
We've
organizations.
invited them to come. Is there anyone that is a part of an OPO that is in the audience? I know we asked people to comment at the beginning, but I'm just asking Chair Fulton if there's anybody that's an OPO that can help us with this.
I don't see anybody raising their hand.
So,
Okay.
Chair Opiola, what I would say to you with that is I've spoken to those organizations. They will not end up in a bioskills lab unless they were donated to science, and then it falls
through a will body program or an
right. Exactly.
Right.
So you're not going to send it to the Marriott because Stryker asked for it and they just throw it to the lab, right? Because once again, that's our process with all this: is you can't have tissue come to your anatomical facility unless it's a registered NATO or will body program, and that specimen has had the whole donor packet entered into the Funeral Commission's website and all that kind of stuff. And that's what we're setting up so this doesn't happen. I can almost 99% assure you that doesn't happen, but let's hear it from the OPOs. I'll try to invite him again. I know one of the CEOs, very kind gentleman I spoke to a couple months ago. So that gray zone that you're concerned about, a valid concern, I don't think is happening. And I think the organizations that are research driven in this gray zone that we talk about, once again, they're developing something that's going to end up being a transplantable material. in that process of that research, it's an appropriate pathway to get there. Whether they have to do research on it for 2-3 years until they figure it out to be able to transplant it. My opinion would be that that's not the Funeral Commission's purview. That's CMS, that's Medicare, that's the federal government looking at things that end up final disposition and I don't want to use the word final disposition, final ending into a body that needed research to do it.
And we would discover that they were doing the wrong thing because they've got to get this facility inspected.
Right.
If they're at a hotel or anything. So we've got the safety nets in here to keep this from happening. Because we discovered that when we did an inspection, we said, nope, you're not doing that.
Yeah. Can you also produce, I know this was a very well put together, research document. Is there a one-pager that could be produced by this committee for us to post on our website for the public to be informed about the various pathways, kind of I'd almost say a flow chart that says, because I think a lot of the public is confused. I am. I mean, I was. I'm not even as well educated right now, but that's what I'd like as a deliverable, so that we would inform the public about when you donate your organs, to give life to another, right, through transplant. What happens next?
Absolutely. And I had spoken to the executive director of Donate Texas. Now, is that the Texas organization where you on the back of your license?
Registry.
Right. So, and he would be an incredible, valuable asset into this input. And so we'll work with him too, as to what, the donor living side of it would like to say in this too, because they have such an incredible website and guides people. But you're absolutely right, because a lot of people are like, oh, well, I did. I signed up to donate my body to science when I die. It's on the back of my license. I'm like, no, you didn't sign up to donate your body to science. What you signed up is for an OPO to pick up your kidneys, liver, cornea, those kind of things. That's what you signed up for. After that, your body's going back to your family for final disposition. Oh, I didn't know that. Can I do both? Absolutely. They can procure kidneys, liver, all that kind of stuff. And then afterwards, what's left behind, that can be donated to science. And so that's when the funeral
That's
commission.
something that's missing. We have the one pager that statute requires us to put together to that y'all worked on a couple of months ago, right? But I think that this is really confusing to people.
No, and I think the Donate Texas would love to make that clear too. Like, hey, this is what you're doing. You can do the second part after we take organs. And so I think that'd be an excellent thing for the public to understand.
Dr. Ali.
There needs to be a caveat on there, because most don't-will body programs will not accept anybody who's had long bones or any, internal organs. Our program will allow life gift, bio gift, and them only take superficial skin and cornea. Other than that, we need the whole body. So there needs to be something on Donate saying that some will body programs or some donation programs will not accept if you do agree to let them have those other organs.
100%. I think there's some organizations that will, but I think that's where it can refer the donee to say, oh, call this organization, ask if they do or don't, understand the process. But I think what Chair Pleo is saying is, please make it easy for our Texans to understand the process and where they can look to or who they can call and where.
And if they have a concern, who's responsible for it? Because we're not responsible for any concerns that the public might have with regard to organ for transplant procurement, right?
Right.
And I think that's confusing to people too. I mean, this problem with Texas being the trailblazer here is, I think there's just one other state that has passed laws, dealing with this, and so this is we're really kind of setting the standard here, and I think we need to do it well.
I think we can set together a nice 1 or 2 pager to help out that.
Okay.
Dr. Ali, AOPO might also have a one pager already in existence.
Who's that?
Association of Organ Procurement Organizations, AOPO.
Okay, perfect. We will, if you don't mind helping me find that document or their kind of informational, that'd be awesome if you can send that to me.
Okay, I can look for something.
Thanks, Mike. I don't have anything else to present on the OPO part except for the informational part of it. And I know the first document we put up was more of like, do we have jurisdiction? Do we not? I think that is a little bit too much. I think that informational research packet that you just looked at is probably better for you to understand and help the commission make decisions going forward.
Thank you.
And Mike Houston, so when you get that document, send it to Mandy, let her send it to Dr. Ali, just so we make sure we do that path and we don't screw up and make a walking quorum sometime or other. Let's just make sure anything we want to get to somebody else, send it to Mandy first, let her send it out.
Thank you.
Okay, anything else? Okay.
Doing the enforcement work
Put
group.
on the work group for enforcement.
The enforcement work group.
Nobody was assigned to the enforcement work group last meeting. So if y'all could discuss who would like to be on that going forward, that would be wonderful.
So Jason Owens, you want to be on that?
Yes, I can be on that.
Okay. I want to have you and Kurt, you want to be on that? Okay. And Mike Houston, you want to do that?
Yeah, I can do it.
Okay. So let's do those three. And then we can bring it back here and discuss different things, how we all of us want to do it.
Yeah, I'd like to have a product out of that work group. What? Go ahead. I'm sorry. Am I not muted? Can y'all hear me?
You're good. You're good. We can hear you.
I just want to make sure, because we have 2 NATOs and 1 wheel body program, do we want to do the enforcement one
Facility.
We can.
I'll be happy to help out with it if you need me to.
Okay. So let's, instead of Mike Houston, put Dr. Ali on it then. Is that good?
I mean, that's good with me. I'm just letting you guys know that
I
we
think
had
that's smart.
two NATOs and 1 wheel body.
Yeah. That'll get us where we need to be.
So you got myself and who else were the other 2?
Jason Owens and Kurt Clark.
Thank you. And Mandy, I got your email about this, and I know you kind of put the funeral side up of their violations and enforcement and those kind of things. I want to make sure we have the right charge in as to what you're asking of us. Sometimes trying to mirror things exactly what the funeral side doesn't really work as well with the anatomical, but at the same time, I get it. We don't want to have a complete different enforcement policy on one side and completely different on the other side. Excuse me. But at the same time, I still got to make sure that these are 2 completely different worlds,
Yeah.
One is
And
healthcare
so,
related medical education. The other one is the death
our
business.
legal, our 2 attorneys, our 2 staff attorneys, that's a great point. We have been learning as we've been integrating anatomical more fully into the agency the past few months, that there's major differences between the 2 sides, and that's okay. They're different sides of the same coin. But that's what legal took a stab at. This is all working draft work on the anatomical side. And the staff attorney assisting us has come over from TDLR. So she's just very familiar with that penalty matrix when it comes to this type of industry, like just industry. And so these are suggestions as of right now. This is a draft. The funeral side is pretty set. It is going to go in front of the commission, but that's been for a long time been established. And I do have some updates, so I'll send the updated draft from our attorneys to the work group that's been assigned, so y'all can see the updated enforcement plan.
Okay.
So I know whenever we had asked for it, I think was the one who asked last meeting if she could send this over, like she was saying, just a draft. I thought it would be a good outline or how they had constructed all of theirs on the funeral home side to help with whomever was designated to the group to create the anatomical side with the reference back to the statutes, the rules, and start breaking through all of our new rules that we have proposed, etc., and determining whether that particular area, 206.1, if that deserves a disciplinary, et cetera, on down the line. So that was my intent of having that sent over, was just to kind of understand and get into their head what they're looking at and how they're trying to model it, so that perhaps we create something that's in similarity, parallel, to where it's not completely a different spectrum of what they were looking at.
Well, we'll tackle a concept of just getting some very basic framework as to, here's all the rules, here's what the Senate bill is requesting. And so if you could just pretty much do it from the moment someone says, I'd like to donate, and then just follow that entire process, and kind of, it almost goes with all the stuff we have, from a donor consents to this, to that, what happens if you don't do it correctly. So I think we can build a framework and then start to kind of break it down between the committee and the commission as to what is appropriate. But I will put forth this, that it needs to be appropriate due process.
Sure,
Not,
that's what we're looking for. So we under the law, we take all of our administrative disciplinary hearings to SOA, and so I encourage you to work with Mandy and our staff attorneys who know that process. And frankly, take a look at what we're doing on the funeral side with our quadrennial rule review. We have our stakeholder meeting on that this afternoon. Take a look at that and maybe use some of that as a framework for where we go here. I will say I'd like a work product on that September 15th or so, because that'll give us, we're kind of compressing our time schedule, dealing, with the anatomical program, doing things fairly quickly in the state government world since I took over as chair April 1st. But, I'd like to kind of get a little bit of a breather here, so that, we could have our stakeholder meeting maybe not the week before the commission meeting, but maybe 2 weeks before the commission meeting, and so and I got to still send all that stuff up to regulatory review. So that's why, and staff have to, take that work product before. So that's why I want to back that up. If we can have something by September 15th, and that'll give us a little bit more room, because really the October meeting is going to be our last meeting to propose rules for comment before the legislative session, right? Because then we have an adoption meeting in December, or that would have that, and then we're kind of closed for rulemaking while the legislature's meeting, right? Because the legislature gets to decide what the law is, and then we get to implement that law. And so I want to respect that part of the process. So that's what I'm saying. Last call for anything really before the session is going to be this next month.
Can I ask a question about that document? Who's the intended audience? Because I read through the draft and it seems like a lot of it is just like a recap of statute. Who's the audience for that document?
Investigators and inspectors, and the whole prosecutorial office within the TFSC. So that's what will be used by our legal department and our investigators and inspectors whenever they identify any violations. Obviously, it will also be posted on the website so people know. I don't know if that exact version gets posted, but there is a version so people know what the penalties are in rule, because it gets put in rulemaking.
Thank you.
Okay.
And I know I've worked you guys hard the last couple of months, and I want to take this opportunity to express my appreciation for everything you guys have done. I thank you, and thank you for continuing to help us through this process.
And I want to say thank you for everyone being at these meetings. Everybody's been at all of them. We've been great. We've moved along. I want to encourage everyone to be at the stakeholder meeting this afternoon at 2:00. Maybe questions.
I think it's 2:30.
2:30. Yeah, because we
want to make sure everything is accurately told to people. Yeah.
So we may need to answer questions or something at the stakeholders meeting. For those of you in this meeting that were not on the committee and had your hand up, I apologize that we could not recognize you, but we had public comment at first. You're able to comment this afternoon at the stakeholders meeting, and you're able to comment when all these things are posted on the state website. Otherwise, during the meeting, you have to comment during the public comment time. Also, I encourage everyone on the committee to be at the commission meeting on the 14th. Because that way, if the commissioners have any questions, we can answer them right then and there so that we can move on and get this stuff going. Jason, you got your hand up?
Just in reference to our stakeholders meeting this afternoon, is there any concern in reference to a quorum of any of our members being, too many of our members being on that meeting?
Yeah, I don't want a quorum of your committee at the stakeholder meeting.
Okay.
I'm sorry.
Okay.
Really, I think if
plan
you
on
have comments and you're on the committee, you're going to need to route those through your chair and vice chair.
Yeah, I will be on the meeting. You're gonna be on it, Dr. Ali?
I should be. I've got patients I have to take care of at 4 o'clock. I think that's a correct statement. I got to see if that schedule's still up, but I should be able to.
Okay. Anybody have anything else for this meeting?
Not for this meeting, but off topic. Maria, can y'all please respond to our NIH grant that I sent you last week after the meeting?
Talk with him after.
Or do I need, you want me to send it to Mandy?
We can talk with you about just for future reference, if we can talk about these things outside of the advisory committee, that would be helpful. So just give us a call. And you can call me directly and we'll discuss it. Thank you.
Okay.
It's not a posted agenda item, unfortunately.
Yeah.
Yes, I know.
Okay. Anything else that is appropriate for this meeting? Do I have a motion to adjourn?
Motion to adjourn.
It's a miracle. It's less than 2 hours. We're adjourned.
Second, yes.
Thanks, everybody.
See you later.
Thank you.
You.